Hi, my name is Jill Donahue. On my continuing mission to help lift our industry, I'm here at the Patient Summit iPharma 2017 in Philadelphia, chatting with Doug Noland from Astellas. Thanks for being here, Doug.
Absolutely, thanks for having me.
So tell me more about what you guys did at Astellas, because I think you're really leading the way with your approach.
Well, personally, I think the heart of the issue is what do we even mean when we talk about being patient-centered? So, at least in our experience, we in the early days ran into folks who just said, we're very patient-focused. What are you talking about? We develop medicines. Of course, we're patient. And I'm a physician, so by definition, I'm patient-focused. And what we learned is really the question is, can we be more patient-focused? And what does more look like? The only way you know is to put yourself in the shoes of the patient and to ask them and to understand, what it's like. What is it like living with disease and trying to navigate a complex healthcare landscape. And if we don't take ourselves out of our kind of functional, let's say, areas of expertise and begin to stretch our minds with understanding what really matters to patients, then we can't innovate and we can't really move towards being more patient-centered.
Since then, you've done the assessment. How are you now spreading it through the organization, helping people see what they need to do differently?
Yeah, so we've taken kind of a two-pronged approach, and a lot of people here talk about that you need the endorsement of leadership. Indeed you do. You have to have a top-down endorsement for leadership, which we have. But we felt like we also need a bottoms-up approach. So we've invited our employees at all levels, across all functions of the organization, to help in this effort. So that's given us the top-down and bottom-up to address culture. And that's really the first kind of prong.
Right.
But we felt it would be a mistake to first address culture and then someday maybe get to strategy and then someday get to tactics. So in parallel, while we're addressing culture, we felt it important to show what good looks like. So we started a quick wins program where we started tackling kind of those issues that we found in the assessment, and said, okay, well, how do we address, as an example, health literacy? How do we begin to make sure that our service and support when a patient calls in is up to standard? And I think when our employees saw that we were tackling these things, it said, wait a minute, we're actually serious about this. This is not, it's not a flavor of the day kind of feel good campaign. This is, in fact, a real change that's being driven.
There are things that are changing.
Yeah, there are things that are changing. So we found the two really have begun to work to reinforce one another and give further fuel to each of those respective efforts. And I think we have an opportunity. I think pharma right now is poised to do even more than we've ever done. I mean, we're already fortunate and lucky to work in this industry. I mean, how many industries can say that they have the kind of impacts that we have, even if we didn't change, right? It's amazing the value that we provide to extend or even save lives in some cases.
Yeah.
But to take that to the next level and to do even more, that's my passion, and I count myself blessed to even get to do it.